hard with some of them.
These are our kids.
But
Okay, well let's do a.
it's like sending them to college. You know, you just have to trust that they're gonna do better because of it.
Well, you all know.
Okay, he's awake. I'm gonna put him in the
Oh,
box.
okay. Let me start off by sharing a picture.
You gotta pee or poop?
Oh,
Are you waking up?
oh shoot, I'm sorry, I'm not.
Hey.
Outside.
Yeah.
Hang on. Okay.
Yeah, I would take more than you just because I don't know. You never thought it was Central. But why now?
I don't even know what I'm looking for. What now I know. Okay.
So
This is Shirley, or this is Lucy Ann last night.
Oh, she
So,
adopted.
She was just adopted yesterday. And this is, can you see her there? There you go. She was adopted yesterday, and this is what she was doing already last night. And her message from her new mama, maybe I will sit down. Her message from her new mama says, we made it home safe and within the, and this is what I like. And within the hour, Lucy was curled up in bed with a full belly. She's explored most of the upstairs, but seems much more interested in us, which is fine by me. We couldn't have dreamed of a better companion, and she settled in super fast. Thank you so much for trusting us with her, and expect more pictures in the coming days. So that's what makes this important. And these are the things I have to always remember when these kitties have been with us so long. You know, it's so hard because it's just hard. And so when I hear the stories like from Preakness and Joey and Lucy Ann, those are the ones that always, I have to always remember that, you know, it's okay, that they can adjust. Yeah. I'll have to look for my, and I've had a few people ask me if we were going to show, oh gosh, my brain is not thinking, Paris and Lynn's on cam, and I did not bring them up here. And the reason is because you know we're on the very, very end of our virus, and we've worked all those months at keeping them healthy and safe, and so we did not bring them up for that reason. So today, Gene, he was finally neutered. He weighed 3.7, and he was so doggone cute waking up. But beforehand, I wanted to put 3 of the boys in one condo back there, and I had to pull Gene out because he was rocking and rolling so much, and the other 2 wanted to sleep. He was just high-wired. So Gene was done, Trey was done, and Cass was also done. And then Faithy, our volunteer here, brought in a cat named Simon, and we neutered him. And then a man that works out at the Defiance College, he's always trying to collect the cats that's out there to get them neutered, and he brought in a male, and we did him too. The girls that we did was Perlissa, our little girl, and you know, she's just everywhere. Oh, she's out there, but she's doing super duper well. And Lynn's and Paris were also done, so we did 3 of the Persian babies today, so we're all done. And Rita was done, Suka was spayed, and Tima was also spayed. He sure did, Dutch, yep. And let me think. So then we did some physicals. Eclair's physical was good. Giovanna, we noticed the last time we did a physical, which wasn't that long ago, that she has some pretty severe stomatitis in her mouth. And you know, we removed a lot of her teeth, but she still has a few left. We gave her a Depo, and that will give her great relief real quick. but if it crops up again, we probably will have the rest of her teeth removed because that stomatitis has a tendency then to just go away. And I think she will feel better, but we're gonna try the Depo first. John had his physical, or well, he didn't have a physical, I just wanted her to recheck his eye where the sutures are, and of course he is fine. Farah, that thing on her neck, and that's why we took her collar off. That's just that eosinophilic plaque that some kitties get, and she's responding super well with the Prad, and it won't be long till we get her collar back on her. And that was good. Her physical was good, and Coralie has a couple teeth that we're going to be watching, and we may have to make an appointment for her dental too. There she is. She says, I'm wide awake. And Zelda had her physical, and I want everybody to know Dr. Darcy said her weight is good. She looks good. And Binker, we finally got Binker. Binker was not happy with us. But when the very first time that she was examined, she put her down as like a 2 out of the 6 heart murmur. Today she said she could not hear it at all. So that's good. Marilyn, she checked Marilyn over. Everybody's been worried about her tummy because it's rather taunt, a little bit roundish and a little hard, you know. And I said, you know, I don't think it's anything because she acts like she's fine and all this, and it didn't feel like anything. And she said she thinks it's just, well, I don't say this, adipose tissue. There we go. Yeah, that it's adipose tissue, a little bit too much of. So she's fine, and that her heart murmur is just nothing really bad right now, and so she said there's really no reason that Marilyn can't be adopted. And I know many of you want us to keep her because she's a good friend with Zelda, or excuse me, with Vernon. But if she can have the opportunity for a home, we need to do that. So she's gotten the okay now the last 2 months that it's okay to adopt her medically wise. So we want to try to do that. Patty Purr, everything went good on him. The last time she rated him 2 out of 6. For heart murmur today, he was a 3 out of 6. Still nothing that we have to do for him. Nothing at all. He shows 0 signs of that. And Patty Cake has always had, oh, thank you, Beth. Patty Cake has always had a murmur, and it always fluctuates between 3 and 4 out of 6. She put him at 4 to 5 today out of 6. His was very easily read, and all the different sounds around the heart, she could pick that up. But again, he shows, you know by seeing him, he shows 0 signs of it. So we don't mess with something that's going good, and he's fine. So that's it for today. We had a couple other cats come in for physicals. We did get another cat in today, and I did talk to some of you about it. I came over after we got his test to make sure he was negative, and asked for prayers and good thoughts for him. This is a boy that was part of a TNR program. Where was that? Is that in Oakwood? Do you remember where that was
It's just
from?
at Henry County.
Henry County, which is Napoleon area. And apparently he was neutered some years ago, 4 years ago or so. And this lady and husband who brought him in had found him, and they helped feed him. And she was so upset on the phone. My heart just broke for her. She just kept saying that he was really bad. So we had him bring him in. And the first thing we noticed was his eye was definitely protruding out, and that he had a big hole here on his side and a hole here on the side of his eye. And I mean, it was obvious to anyone to look at him that that eye had to go. It was beyond repair of any kind. So he's all four of his legs are sore. He walks very gingerly on them, like they're also. I think it was a dog bite. I think he was mauled by a dog. This is the second one in 2 days we've had here. The other one belonged to a visitor, or excuse me, to a volunteer, and that one is on medication and shaved up and cleaned and already back home. But this one we're going to keep here. Excuse me a second. I don't have anything else to grab. Here, come on, get the can. Oh, oh no, you're not done. Okay, let's put you down.
Just in case.
Yeah, we'll just set her over there. Better down on the floor than
Yeah.
where she was at. But so they brought him in. He's been neutered for a few years, and he just got himself in trouble. I do think it was a dog that did it because of the bigness of the holes and how far apart the fang marks are. So one of the fangs, obviously, we think went into the eye, and then on the side, and and then on the other side. We didn't realize until we were almost done. Dr. Darcy was almost done with the eye enucleation that his jaw was also crushed, and it's back here. It's clear back here. So we held his. I kept his jaw in alignment, and Dr. Darcy did a tape around his mouth so that he can't open it, but he's got enough room to stick his tongue out to be able to lap, and then he's got tape that goes clear around here. So he's got tape around here, around his mouth, and then his eye enucleation. If we can get that, keep that tape on for 2 weeks, she thinks that the jaw will have bonded enough there to be stable. So we're just gonna take it as it is. He's such a nice boy, isn't he?
Oh, he's a sweetheart.
He's just a sweetie pie. So we'll see how he goes. Yeah, time will tell. Well, I don't know. He's a hurting for certain guy right now. We just medicated him again for soreness, and we will definitely keep up on 2 ways. One will be a 24-hour soreness med, and the other one is every 8 hours. He's very swollen right now, where his eye and we really scrubbed up these holes, and then we'll flush out those holes also. But we'll see how he goes. What we did was his endotrach tube that we had in him. We kept that in while we did all the taping, and then when we pulled that out, that left that little bitty. It's like a 1 cc hole in his mouth right here, so he can get his tongue out. And I gave him 30 cc's of sub-Q fluids to get him through till tomorrow, so that he's hydrated enough through the night. Yeah. I don't think he was a fighter. I think he got the fighty on him. And then Marcus, the couple, you might have seen them come in. They're out right now visiting the Coveys and looking for Jackson 2. I don't think they'll see Jackson 2, but they also brought him, and they're going to look for him. But in the Cove, Leonard was one of the cats that they brought here. Marcus and Victor. And Victor is still out there at the Cove. So they're out there visiting them, and whenever they come, they always bring a big bag of freeze-dried chicken. So I'm sure the kitties are very happy out there. Yeah, we'll find a good name for him. I think he's probably at least 5 years old, because they thought he was neutered probably 4 years ago.
He's a big boy.
He's a big boy, or I think he'll be bigger. Dr. Darcy thinks that these wounds were at least a week old. I do not think Marcus will be going back out, LJ. he's just kind of dumpy yesterday and today, and I think I would be a nervous wreck letting him go out there. And he's comfortable in here. He is sleeping an awful lot. His respirations have been going up. It's still in the 40s and 50s, and then coming down again. And he does become dehydrated with the Lasix, but it's a fine line of how much to give and how much not to give. And I just will feel much better if it gets to be really nice, and if he wants to get up and walk around, I can see where we could take him out for a little visit out there. But he's doing very well up here. And the other one, yes, he'll be able to get his tongue out. He can get his tongue out, so that he can lap. Corley's tummy's issues, we've been giving her 2 medications a day for that IBS, and she may still throw up a little bit, but I'm hoping not. She's actually already gained a couple ounces. So we'll see how she does. I'm encouraged. Shirley May, we hope will be adopted. She may always have, that little crooked head, but it's kind of cute. All right, did I hit all the things, all the questions?
Just needed one more instead of you. You'd be complete.
Yeah, that was a Friday night. It's been 2 weeks that when we weren't sure if he was going to make it that Friday night. Yeah. And I can tell a little bit that Shirley May might be feeling a little better. She's out and about a little bit more. And also, we have Mama Cat in here too. She's in the back Thumper's room. They took out, like I said in the blog, quite a bit of that mass that was in there. We'll know more about that biopsy later, but she did get quite a bit of that out. And both of these cats are not very nice or not very easy to medicate. So we talked about that today. We're going to give long-term injections to them tomorrow, and that way I don't have to be fretting about, oh gosh, we missed this one or we missed this dose. There's no doubt that Mama Cat is eager and wanting to go back out to be in her firehouse. So we will probably let her go, but not until I can get as many treatments in her individual doses as what I can. Yes, we have adoptions tomorrow. Okay, wait a minute. 8:45 is going to be Snowy and Rita. And then 12 noon is when Perlissa goes. Yep, 12 noon is Perlissa. 8:45 is Rita and Snowy. Jeannie was on top of Dodger's Pin today. I had to do a walk back and make sure that was her up there. She's a nut. Oh, thank you, Packer. All right, I'm bushed. I'm going to go take care of my mama. She's probably waiting for supper. It is, I used to always make sure I was out there by 5 because it would get dark. And she wanted the blinds down. Look at it, 20 till 6 and it's still lightish out. Oh, I will, Goosty. Oh boy, you know what? I tell everybody this time of year, this is the time of year that is our prime time to get those older teenagers and adults adopted. Because once the spring babies come, they get kind of put on the back shelf again. So, yeah, and I'm so thankful for these adults and teenagers like Pilvi too that got to go. Yeah, I tell everybody, enjoy this slacker time because it won't last for long. Thank you. I will tell my mom. Oh, thank you. Yeah, it's these days are stressful. I worry. I'm a great worrywart. All right, thank you, everybody. Love you all.